The federal response to the coronavirus is entering a new phase this morning, with President Trump pushing the FDA to fast-track possible medical treatment for the disease, and lawmakers on Capitol Hill anxious to fast-track much-needed financial help.
These are urgent discussions. They need to happen at a member level, and they need to happen starting right now.
Senate Majority Leader Mitch McConnell unveiled the Republican plan Thursday that would provide direct payments to Americans. Based on 2018 tax returns, people making less than $75,000 would receive $1,200 each, while anyone making above $99,000 would not get a check. The measure would also provide relief to businesses and provide more support to healthcare workers.
We know this legislation will not be the last word.
Doctors, nurses, and technicians in some hard-hit states like Washington State are now running out of supplies.
We may be reusing masks and trying to conserve things like the respirator hoods.
The shortage of supplies in some areas has the CDC recommending doctors and nurses use homemade masks or even bandanas as a last resort. Meanwhile, President Trump touting two potential treatment options that the FDA is looking into: an antiviral called remdesivir and chloroquine, which is used to treat malaria.
Essentially approved for prescribed use. And I think it's going to be very exciting. I think it could be a game changer, and maybe not.
But the drugs are not approved yet, and the head of the FDA says getting there will take time to ensure they're safe and that they work.
We need to look at it. We need the data. We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time.
It all comes as the State Department issues new guidelines telling Americans not to travel abroad, and for those already overseas, return immediately. The question this morning: how long will America's new reality last?
When can Americans expect their lives to go back to normal?
I hope very soon. We'll see. This is uncharted territory.